Hi, good evening everyone. Welcome back to another live session by IILT. I'm Richa Carolin. Hope you're all doing well. So today we are going to look into another speaking topic, and you guys have seen the topic that we are going to discuss, which is simplify the conversation. So if you can, if you guys see here, you can see types of conversations or types of role plays. So you must be wondering what is the simplification, the title which is given, and what is this topic here. So there is a very strong relation between simplifying the conversation and the types of role plays as well. So that's the reason why I have got a topic like this here. So we will discuss the common types of role plays and how to simplify the conversation in that aspect too. Okay, so that is our topic for today. Yes, good evening everyone. Hope everyone is doing fine, and hope your studies are also going well. So we got a lot of response for the previous live, and it was a huge response, and I'm happy to hear that people are actually finding it really helpful, as well as they're learning a lot of information from that too. So I hope today's lesson is also going to be interactive and going to be informative for you guys. Okay, so without wasting much time, I think we can start with the live session. So as you can see, this is the main topic that we are going to deal with. Okay, types of role plays. So what are the common role plays that we see? We kind of like get non-cases and non-cases like emergency department, community health center, we get school health nurse, we get mental health clinic, we get skin clinic. So there are different settings that we deal with, right? So it's a vast topic. We cannot just confine it to a limited resource because it is kind of like really vast. So I actually picked the common 6 types of role play cards. I'm not saying that these are the only types of role plays that you might come across. There are a lot of others too, but I have picked the common ones. Okay, the common type of role plays that you can see for the examination. Okay, so that is what we are going to discuss. So let's begin with it. So these are the common types of role plays that I have seen, which are kind of like repeatedly asked for the examination, or these type of questions are very prominent or very familiar when it comes to the OET speaking subtest. Okay, so the first one is informative cue cards. Informative cue cards, as the name suggests, it's where you provide information to the patient or the bystander. Okay, you're providing some sort of information. It might be related to the medication or the treatment or things like that. We will get into it. Okay, we will see what these 6 types of role plays mean in the next slide, in the coming slides, but I'm just giving you a brief idea about it. Okay, so informative is nothing but you're providing information or you're educating the patient or the bystander, depending upon the case note that you're dealing with. Okay, so that is the first type of cue card. The second type of cue card or the role play that you might come across is emergency. Emergency means where you're talking to a patient or a bystander who is in a very, in a very emergency kind of a situation, and you need to do something immediately. Okay, so that type of cue cards you might get it. And then we have mental health. It's a very common type of cue card or role play that that is being asked for the examination these days. So that is another type of role play that you might come across. Then we have grief or end stage. That is also very familiar for you guys. Concerned bystander, very common. Okay, these type of cue cards you can expect it for the examination. And then we have reluctant cases. Okay, so whenever we discuss other types of role plays, we cannot move forward without reluctant cases because that is very popular. So we will be discussing about reluctant cases too. Okay, so these are the 4 types of role plays that we are going to learn today or look into today. And the main thing that we are going to do is we are going to try to understand what these type of role plays mean or indicates, as well as we are going to see certain statements or certain phrases that you can use in these types of role plays. Okay, so which will simplify your conversation. The reason why I'm saying simplify the conversation is because when it comes to the OET speaking subtest, what you need to show is your ability to communicate in layman's term. Layman's term means the common man or a common person who is listening to you should be able to understand what you're trying to convey there. Okay, so that is our main aim. Our main aim is not to show them that you have really good vocabulary or you're great at sentence construction or you're language efficiency is absolutely fantastic. Okay, yes, if you are having all those things, well and good, there is nothing wrong in it, you are doing really great. But for those people who find it difficult to speak continuously or spontaneously or come up with vocabulary, kind of like instantly, you do not have to worry about it. Okay, so that's not what they're actually looking into. It is considered because the linguistic criteria is there, but what they consider more is your ability to communicate with this patient or the bystander that you're dealing with. So that is the main aspect that you have to consider. Okay, so in order for a person to understand you very easily, and at the first instance when you're explaining certain things, it is very important that the way you construct a statement or the way you communicate, show empathy or reassure, it has to be in the simplest form that you can use. Okay, so we are going to look into each of these role play types, and then we will discuss in detail about certain statements or certain phrases that you can use in these types of role plays. Okay, yes. So I can see many people there. So good evening to everyone. So we can move forward. Okay, so we are going to look into the informative types of role plays. Okay, so in the informative types of role plays, this is what you will be dealing with. These types of role plays will ask you to give information. That means that you have to educate the patient or bystander, and it might be related to these things. It might be related to a medication, or it might be related to the procedure the patient has to undergo, or it might be related to certain treatments. The patient might ask you information about, okay, I have been diagnosed with this condition and the doctor told me to start with this treatment, but I need to know more about it. Okay, so that is it. Medical condition. Certain diagnosis, this diagnosis or the medication they have to take for it, and the side effects related to the medication. So there are certain things the patient would require information from you. So whenever you see such cue cards, you have to understand that, okay, so in this particular cue card, the patient is having a lot of concern about this particular thing, and my duty is to provide information for the patient related to the concerns the patient has. So this is your informative type of cue card. Okay, the next one you have is emergency. The name itself suggests the meaning there. Okay, so these type of role plays is where the patient is in some sort of emergency. Okay, the patient or the bystander. Okay, and they require help immediately, which means as a nurse you have to start immediately with the data collection, checking the vitals, whatever is required in the cue card or whatever is mentioned in the cue card, you have to move forward with it very quickly. Okay, so these type of cue cards are called emergency cue cards. Then we have the mental health cue cards. So it is also understandable, right? Mental health, these role plays will ask you to deal with patients who have mental health issues or who fight with mental health problems or struggle with that. And mainly the type of cue cards that we get for mental health are these three. Okay, I'm not saying it's just confined to these three, but the common ones: eating disorders. Yes, we have seen cases like bulimia, anorexia. So certain cue cards are there, and then we have OCD kind of cue cards, and we have depression cue cards. Okay, so these are common type of mental health role play cards that you might come across. Okay, so that is with mental health. Then we have grief or end stage. It's kind of like a difficult cue card. I won't say very difficult, but still I see many students finding it really difficult to deal with grief or end stage patients, because they wonder, what can I say here? How can I talk to this patient, or how can I deal with a patient who is grieving, or how can I talk to a patient who is in an end stage condition? What will I say there? So these types of concerns or the lack of ability to provide emotional support to such type of patients is very common in students. So we will discuss about that as well. I'll come up with certain statements or sentences that you can use. Okay, so if you guys also, while we are discussing the statements, if you guys also would like to contribute any statements from your end, feel free to do that. Okay, just type in so others can see it and they can also learn from it. Okay, so let's make it a little interactive there. Okay, so grief is where you talk to a person who is in intense sorrow. Okay, they are really worried, or they are actually in a melancholy state, and or you are talking to a patient who has end stage conditions. Okay, we have seen cue cards like end stage renal failure. Okay, for a patient, the treatment is not working, it's not curable, it cannot be reversed. So we have seen many cases like that too. Okay, so that is this type of cue card, grief or end stage. The next one, concerned bystander. A very popular cue card. We always get it, even when you're preparing for the examination, or even when you join an academy. You get a lot of cue cards where you can actually practice this. Concerned mother, concerned father. You get this a lot. Okay, and this is a popular thing too. For the examination also, I have seen a lot of times concerned bystander cue card is popping up a lot of times. So if you practice more of concerned bystander, it is going to build your confidence also to deal with such cases. So it will be a little more easier for you to come in action when it is actually asking you to do it. So this is another very important topic. So in this particular role plays, you need to deal with a worried father or a mother, son, daughter, friends. We have even seen cue cards where we are talking to a friend who brought the patient, who is the friend. So the patient is has met with an accident, or has had a fall, or the patient, or we have even seen cases where the patient died of excessive smoking because the patient had cancer, not of excessive smoking, the patient had cancer, but the patient had excessive smoking habit. And we have seen cases where the bystander is coming to you and talking to you like, and I'm really worried whether I might also have the same fate. Okay, so such cue cards, we have seen such cue cards too. So these are all concerned bystander setup, and in this particular thing you need to provide a lot of assurance, you need to provide a lot of information, you need to provide a lot of reassurance, because they're concerned. The word concerned itself suggests that they're so worried, super worried. Okay, so when you get such cases, the first thing you need to understand is, okay, now my purpose is to console this patient. Again, then I have to convince this patient to do this thing, or I have to convince this bystander to be relaxed. Okay, so you need to understand that. You need to understand the type of role play that you are getting, and then you need to understand what you have to do about it. Okay, only then you will get a clear-cut idea about how to move forward with this conversation, how to deal with the entire cue card and do each task one by one. So that is significant. Okay, so concerned bystander is the next one. Moving on to the last one is reluctant. So reluctant role plays are where you need to deal with a patient who is very uncooperative and aggressive, stubborn, okay, frustrated. Okay, we have seen a lot of cue cards like that, and people find it a little difficult to deal with such cases too. The main thing I have seen here is, when you deal with a reluctant or an agitated case, do not change your tone of voice, because you might be starting with a really strong, confident voice in the beginning, but have seen the many students feeling nervous or their voice crack because the moment the patient or the examiner starts raising their voice like, don't you understand, I don't want this treatment, how many times do I have to tell you this, please don't irritate me, or please do not come and tell me this again. So when the patient starts arguing or show the reluctance or be agitated, I've seen many students losing their confidence and their voice starts to crack up and they kind of like become very fragile. Do not ever do that. First thing you need to understand is the examiner, or whenever you're training with your trainers or your friends, they are doing their part. Like you have a cue card, they also have a cue card. Like you have a dialogue, they are doing their dialogue, they are delivering their dialogue. Okay, so you do not have to take it personally. The main problem I have seen when people doing reluctant cases that they take the thing personally and they get nervous. Okay, he's shouting at me. What can I say now? Don't take it personally, okay? They're not shouting at you. They're just doing their task. What you just need to do is stick on to your task. See, you'll have a lot of bullet points given there. Just stick on to that. Try to frame statements from it and then speak. Okay, with regular practice, you will be able to do that too. So in today's session, we will be looking into certain statements that you can use when you're dealing with reluctant cases. Okay, so these are the types of role play cards. Okay, I have only picked the common ones. There are a lot of other formats too, but we are going to discuss these common 6 role play cards that you can expect for your examination. Okay, now once you understand the type of cue card or the type of role play you are going to deal with, the next thing you have to do is try to understand the purpose of the role play. It is very important. Now, why? Why is it important to understand the purpose of the role play? It's because you need to understand whether you have to educate the patient so that you can prepare with your explanations. You need to understand whether in this particular role play you have to convince the patient, okay, to start with the medication or to start with the treatment, so then you can prepare, okay, now here I have to convince my patient to do this, so I have to come up with the importance and benefits of this particular thing, so you can frame your explanation in a way that you're ready for it. Then you can also try to understand the purpose of the role play, where you need to, whether you have to provide a lot of emotional support for the patient or whether you have to encourage the patient, like in cases of grief or end stage patients. Yes, you have to concerned patients, you have to provide a lot of emotional support. So once you try to understand the type of cue card that you're dealing with, the next thing you have to do is, what is your purpose? Learn your purpose. Okay, when it comes to the writing task, what do? We directly go to the end of the case note where there is a writing task, and we try to learn from it. Okay, we try to absorb information from that area, right? Like why you're writing this letter, to whom you're writing this letter, so you get a lot of information there. Likewise, do not directly jump into the tasks or start reading the task or frame your task explanation and things like that. Instead, the first thing you have to do is try to understand what type of cue card you're dealing with, whether it is informative, whether it is a kind of like educational informative cue card, or where you're dealing with an emergency situation where you have to provide information to a concerned bystander. So try to absorb the type of cue card or the information given there, and then you have to read the background information which is given and try to understand what is your purpose, why you're doing it, okay, what does the patient or the bystander require from you. Do they require an explanation? Do they require more details or the explanation about the procedure? What do they require? Emotional support or an extra additional help? So you need to have an idea about what exactly is your purpose as a nurse there and what you have to provide for the patient. Okay, so that is the next thing that you have to do. Understand the purpose of the role play. Okay, now we are going to look into some statements, okay, that you can use in these 6 types of role play cards that you might come across. And some of these statements might be familiar for you guys, and some of the statements might not be familiar. This is just a reference, okay? I'm not asking you to completely by heart this or completely follow these methods, but these are just references for you. If you can learn these and try to use these statements in your own words in the OET speaking, then that is going to create wonders. Okay, it is going to improve your score, because whenever you use certain statements like this in that particular role play, that is going to build your rapport, your connection with the patient, so that you can get a better score. Because our main area that we have to focus is to have a good communication. Okay, that communication between the patient or the bystander and you as a nurse is imperative. It is super important. Okay, so you have to focus on that area there. Okay, so I've seen many students who are really good at their language, who have a strong English proficiency, who can maintain the proper structure, the sequential flow of the conversation, who can create beautiful statements. Like the sentence construction is marvelous. So I've seen many students who do like that, but when their results come out, they're coming around to 340. Why? Why is it coming around to 340? Just because you just focused on the task explanation and you're not giving more importance to the conversational aspect of the role play, because you are getting involved or you're getting lost in the entire idea of completing the role play or completing the tasks. Don't do that. Okay, it is important. I'm not saying it is not. Yes, but you have to give equal importance to building a rapport with the patient. Okay, you have to simplify the explanations. Do not just rush with the explanation of each task. Do not get lost in that. Okay, you make sure that you're listening well to the patient, you are responding to the concerns of the patient, you are using certain empathy statements with the right intonation, with a good voice modulation. Do not simply say empathy statements there. Okay, that is not going to make any difference. If you just say an empathy statement, that's it, you have just said it. But if you really mean it, that is going to create a lot of difference. So always keep in your mind to keep it conversational. It has to be an interaction, because role play means two people are involved. There is a speaker, that is, there is a nurse and there is a patient. So it has to be a two-way communication process. You have to listen actively to the concerns of the patient, respond to that concerns, tell the patient that yes, I understood your concern, and then get into the explanation of the tasks. Okay, so that way you are engaging in the conversation. If you directly jump into the explanation of the task, say for example, when the patient is asking you, so could you tell me about the recovery, and you're telling the patient, yeah, it will take 3 to 5 months. Yes, you gave the answer there, but it was not interactive, it was not conversational. The patient is like, okay, 3 to 5 months. The patient is not having a personal, not personal, but not a good professional rapport with you too. So if we look in another aspect, if I say, if I check whether you have completed the task, yes, you have completed the task. But if it is beneficial for you, no, it's not really beneficial for you. So what you have to do is, when someone asks you a question like, could you please tell me about the recovery, you can understand, right? The patient is worried about the recovery. So you can respond to it. Mr. David, I do understand that you do have a lot of questions about the recovery. Let me make it clear for you. And then say, usually it takes 3 to 5 months of time, and I know it might be not very easy for you to take rest for 5 months, but please make sure that you do that, because it is very important for your recovery. So that kind of an explanation is amazing. Okay, it will really boost up your score in the clinical communication area, and you can easily get a big grade. You do not have to worry about it. So instead of just giving straight blunt answers to the questions of the patient, just try to provide a response first and tell the patient that yes, I understand this is your concern, and then move into the explanation. That is going to be really a game changer for you. Okay, so try that method. So without wasting much time, we are going to look into certain statements that you can easily learn and easily use in your OET speaking. So I have categorized it into the different types of role plays here. Okay, so the first one we are going to look into is informative type of role plays. So I've also explained what is an informative role play. An informative role play is where you have to provide information, okay, or you have to educate the patient about certain things. So now the first statement that you can use in such type of cue cards are, I will explain everything in detail to you. Don't worry, I'll explain everything in detail to you, and this is a very common statement that you guys always use. Okay, so the common mistake I've seen in this particular statement is where people say, I'll explain you. Okay, don't worry, I'll explain you. Do not forget to say I'll explain to you or I'll explain that to you, because when you're explaining, you're transferring one information from you to another person. So there is a transfer, so you have to use that to there. Okay, so instead of saying I'll explain you, you can say I'll explain to you, or don't worry, I'll explain that to you. Okay, so that is the first one, I'll explain everything to you. The next one, don't worry, I'll take you through each points one by one. Okay, don't worry, I'll take you through each point one by one. So in that particular area, say for example, if the patient asks you, I've never undergone this procedure and I don't know what you're going to do in that, and I'm really concerned about what is going to happen to me or what you're going to do to me during that procedure. So you're telling the patient, don't worry, I'll explain or I'll take you through each point one by one. Okay, that means that I'll explain each point one by one, and then you can start the explanation. Okay, so that is another statement that you can use. The next one, Mr. David, it's my pleasure to explain how the medication works. Okay, so the patient is asking here, do you think this medication is effective for me? Because I don't think so, because I've heard that taking this oral medication is not very effective for me. So you can say, Mr. David, it's my pleasure to explain how it works. Okay, I can explain that to you. Okay, I'll tell you how it is effective or what the medication is going to do to you. Okay, so that is another statement that you can use in such a situation. Okay, the next one, I understand that you know very little about the procedure and it is worrying you. Please don't be, I'll explain it to you. See how beautiful that statement is? It is somewhere related to the second statement that we have seen. Okay, the procedure. Okay, so you can change it. Okay, as in if you want to replace this with procedure can be replaced with medication, treatment, whatever it is. Okay, depending on the cue card or depending on the task that is given, you can change it. So here we are telling the patient, I understand that you know very little. That means you don't know much about this particular thing, and it is worrying you. And I get it, you don't know about it, and that is worrying you so much. Please don't be, okay, I will explain it to you. You're offering help, okay. So instead of simply saying, I'll explain that to you, if you use this thing, that will also be better, okay. I'm not saying you cannot simply use one simple sentence like this, you can, but this one shows a little more of an enhancement or an improvised language from your area, so you can try to explain that things too. So here what we are doing is, we are actually addressing the concern directly, okay. When we ask the patient, how can I help you, okay, or may I know the reason why you're upset, the patient is telling you, okay, the doctor said that I need to undergo this procedure, but I don't know anything about it and I'm so concerned about it. The patient is telling the concern. So we understood from the conversation that the patient has never undergone the procedure, the patient is really worried about it, the patient has so many questions about it, okay. So we got all these three information from the discussion with the patient. So we can use it back, or we can use that in a conversation, okay. As a response, you can say, I understand that you know very little about the procedure and that is worrying you. Okay, the reason why the patient is worried is because the patient doesn't have much information about what is going to happen during the procedure, right? So that is the main part that we are echoing back to the patient. We are responding to the patient. Okay, I get it. I understand this is the problem. Please don't be. I'll explain that to you. Okay, so if you relate to the context, or if you bring these conversations in your mind, you can see the clarity there. Okay, I understand that you are listening to the patient's concern, you're telling the patient, okay, I understand this is your concern, and you're assuring the patient, please don't worry, and you're offering to help. I'll explain that to you. Okay, so when you do things like these, it is going to be more good, or it is going to be more conversation with the patient, and you can improve your score. Okay, so that is the fourth statement. The last one, feel free to ask me about anything that worries you. Okay, which means the patient seems to be really worried, and say for example, you're dealing with a patient who is in a ward. Okay, let's just imagine a situation, and you're talking to the bystander, and the bystander is there, and the patient is the bystander's mother, okay, and the mother has been scheduled, or the mother has been advised by the doctor to undergo urinary catheterization. Okay, so you are going there and you're going to prepare the mother for the procedure, and you're talking to the son or the bystander. Okay, so the bystander told you, I'm a little worried about it, because I don't know much about this procedure. So you can when the patient or the bystander expresses such concern, you can use this statement, feel free to ask me about anything that worries you. Okay, so that you're offering help, you are providing information, you're ready to provide information. Okay, that's a very effective method that you can implement. So this is also one simple statement that you can use. So besides these statements, there are numerous statements that you can come up with. I'm not just saying these are the only statements that you can use. There are a lot of other beautiful statements that you can use, but these would be simple ones, and these would be easy for you to remember as well. Okay, so try to do such or use such statements when you're dealing with informative cue cards. Okay, do not just simply say, yeah, I'll explain that, and then start with the explanation. Try to relate with the patient by using any of these statements and then provide the information. Okay, so that is how you can simplify the conversation while you're dealing with an informative role play. So I hope that is clear for you guys. Okay, alright, so if you guys have any questions, feel free to ask that too. So we will move on to the next part. So I hope the informative role play is clear for you guys. So we'll move on to the next one. The next one is emergency. So emergency, you guys understand that, right? We are dealing with the patient when the patient has come to the emergency department. Maybe the patient has some difficulties, maybe breathing difficulties, or the patient had a fall or met with an accident, or some sort of a very sudden issue with the patient. Okay, so these are certain statements that you can use. The first one, you have reached the right place, let me see what I can do to help you. Okay, so when the patient comes there and you ask the patient, how can I help you, or what is the reason for your visit, or may I know whether anything is wrong with you, you ask such a question, and the patient explained the patient's problem. So you can say this, oh, you have reached the right place, let me see what I can do to help you. Okay, so that is one very common statement, and I always use this in my role plays too. Whenever I do the role play videos, I use such statements too. Okay, so That is a very common one. Second one, I can only imagine how traumatizing that must have been for you. Please relax, we will do everything needful. Okay, this statement can be used in a similar situation like this. Okay, but the term traumatizing can be used when the situation is also really hard, maybe like the patient had a severe accident or something like that, okay, which was kind of like a traumatizing event. Do not simply use the term traumatizing with every cases that you get. Okay, you need to understand the severity and the intensity of the case that you're dealing with, and based on that you can use these terms. Okay, so this is a very beautiful statement. I can only imagine how traumatizing that must have been for you. Okay, I can only imagine. Okay, because I can't only imagine means I can only imagine means, oh, that is so bad, that is very hard to know, or that is really hard to understand, means hard to learn that from me. Okay, such an explanation. So you can even change the term traumatizing and you can replace it with rough, difficult, hard. I can only imagine how hard it must have been for you, or difficult it must have been for you. So you can replace the terms there. Okay, please be relaxed, we will do everything needful, you are offering help. So this is another simple statement that you can use when you are dealing with emergency type of role plays. Okay, next one, I'm sorry to learn that you are in so much pain. I assure you that we will help to improve your condition. Okay, I'm sorry to learn that you are in so much pain. Common statement that we use all the time, and then we are assuring the patient that we will help to improve your condition. Okay, the next one, I need to run a quick examination to make sure everything is all right. Okay, so mostly in the emergency cases we need to examine the patient, so this is something that you have to always use. So a simple statement is, I need to run a quick examination so to make sure everything is all right. Okay, so instead of saying may I examine you, that is also good. Okay, I'm not saying that is not good, that is really beautiful, but this will be a little more better one. So this is another way of telling the patient that I would like to examine you to make sure everything is all right. Okay, so if you look at all these statements, you can see that we are not just offering help, we are also assuring the patient. Okay, so here we are offering the help means you have reached the right place, which means that we are there to help you. Let me see what I can do to help you. We are assuring the patient, let me see what I can do to help you. Okay, here also please be relaxed, we will do the needful. Okay, I understand that it must have been traumatizing for you. Please relax. We will do everything needful. This "we will do everything needful" is an assuring statement. Like you are providing the assurance there. If you look here, okay, I understand. I'm sorry to learn that you are in so much pain. So we empathized with the patient, and then we are providing the assurance. I assure you that we will help to improve your condition. Okay. So whenever the point that I have to explain here is that whenever you empathize with the patient, always try to club it with an assuring statement too, so that it is little more stronger there. Okay, so simply saying sorry, I'm sorry to learn that you're in pain, that is not going to be that effective. But if you say that I'm sorry to hear that the pain medication is not effective, I will inform the doctor about it. So when you say I'll inform the doctor about it, the patient is like, okay, something has to be, something will be done about my problem. Okay, or my problem is going to be considered, or something is going to be done about it. So you always keep that in your mind. Whenever you feel sorry or whenever you empathize with your patient, try to always club it with an assuring statement too. That is going to be the brilliant way to build a relation with the patient. Okay, so try that method. So these are the certain statements that you can use in an emergency type of a cue card. Okay, so I hope it is clear for you guys. Let's move on to the next one. The next one is mental health. Yes, so we get these types of cue cards, and the thing that you have to keep in mind while you're dealing with mental health cue cards is that it is sensitive. Okay, nobody likes to be labeled as a mentally ill patient, or nobody likes to know that their mental stability or their sanity is not normal or they are abnormal. So nobody likes to know that, right? So whenever you deal with mental health clinic cue cards, understand that is a very sensitive topic that you're handling. And your tone has to be super sensitive there too, and you have to be polite and understanding there, and you have to use certain statements which are not offensive. At the same time, you have to convey the message also. Okay, so we are going to look into certain supporting statements that you can use when you're dealing with mental health clinic. Okay, it will simplify your conversation I strongly believe that. So let's see. The first one, I'm really sorry you're going through this. I'm here for you if you need me. See? Okay, so when the patient walks into you or meeting you and you started the conversation, you ask the patient what is wrong, and the patient is finding it difficult to talk, or the patient is finding it so hard to explain the things to you, you can say this: I'm really sorry that you're going through this. I'm here for you. Okay, if you need me, don't worry. I'm here for you if you need me. I'm here to help you. So that is a beautiful statement that you can use. Okay, the next one. That sounds really difficult. How are you coping? Okay, so when the patient is explaining certain things like, I'm finding it difficult to sleep, or I'm finding it difficult to balance my work life and my personal life, I'm getting frustrated, I'm not able to concentrate in one thing, I was not like this, I feel really bad about it. The patient is explaining the problems the patient is going through. So you can say that sounds really difficult, and we need to know what the patient has been doing about it. Okay, so we can ask a very simple question: how are you coping? Are you doing well? Okay, are you able to manage it? So that is another beautiful question that you can ask. One mistake always the students make here is that, how are you coping? They ask, how are you coping up with it? Or how do you cope up with it? So you do not have to say cope up or coping up with it. You can say coping. Either you can stop here like, how are you coping, or you can say how do you cope with it. You do not have to say cope up with it. Okay, how do you cope with it, or how do you manage it, things like that. So that is another statement that you can use. Moving on to the next one. You have come so far amidst of all these issues. You're encouraging the patient there. Okay, amidst of all these issues means, I understand that you are amongst a lot of issues and you have come so far. We are emotionally boosting the patient. You are a fighter, you are a survivor, you're doing really good. Okay, so that is that statement. Then next one, do you want to talk about it? I'm here to help you. If the patient is telling you, I'm not being able to do this, I'm having these problems, and the patient started to explain things, and then you're like, okay, yes, do you want to talk about it? I'm here to help you. Okay, so this particular topic can be used here also. Okay, instead of telling the patient, I'm here to help you, I'm here for you, you can talk to me, you can also say, use this one: do you want to talk about it? I'm here to help you. Okay, if you're facing certain difficulties, if you feel like that you're not being able to cope with the situation, if you need any help, or if you want to talk about it, I'm here. Okay, so that is another way of offering help, or another way of telling the patient that you're doing good. Then, I know it's difficult to speak now. Take your time to explain what is worrying you. Okay, I understand that you cannot give all the time of your role play for the patient to talk. Okay, that this particular statement doesn't mean that the patient can take the entire 5 minutes to think and talk. Okay, that is not the meaning of this particular statement. When we tell the patient, okay, take your time, that means that we are giving the we are making the patient comfortable to talk or express what the patient is going through. Okay, when you say this particular statement, that doesn't mean that the patient is going to sit there and think for 5 minutes. Again, your entire time is going to run out. No, that is not the meaning of this. The meaning is, I know it's difficult to speak now, take your time and explain what is worrying you. Okay, maybe the patient might be feeling little breathless while the patient is explaining things. They might be a little hesitant to come up with explanation. So you can say, I understand it's difficult for you to speak now, take your time and tell me what is wrong. Okay, so such statements are really beautiful, and such statements will make people comfortable and they will be okay to talk to you. So try to do such things there. All right, so this is how you can deal with a mental health type of a cue card, and these are certain beautiful statements that you can include in that too. Okay, so try to learn this and try to use this. Okay, so moving on to the next one. Grief or end stage. Okay, so that is a really important topic. Okay, so I'll give you guys a minute to go through the statements here, because grief or end stage situations are a little difficult for students. I've seen many students finding it difficult, and they tell me, ma'am, I'm not getting the right word to express it. I have everything here, I know what to say it, but I'm finding it very difficult to express in my words. So it is an area that you need to practice a little bit, because if you know how to provide or express your your feelings, or express your emotions or your empathy to the patient, then it will be easier for you to do it. So I need you guys to have a quick look through all the statements, and then we will discuss it one by one. Okay, so here it is. So try to read it and try to understand what it is. Okay, so then we will discuss each point one by one. Yes, so I hope you guys have read through it. So the first statement, I can only imagine how difficult it is for you. Okay, so when you tell a patient who is in intense sorrow, you cannot tell the patient that I understand what you're going through, because grief is something where the patient himself or herself, or the bystander himself or herself, is going through a very difficult situation, maybe like the death of someone beloved, or very, something like, say for example, if the patient has to face something really sorrowful. Okay, so we cannot use the statement I understand or I can understand what you're going through, because that is totally a different case, right? So here what you can say is I can only imagine how difficult it is for you. That means that, oh, it is very difficult and I can only imagine it. Okay, that is the meaning that you're conveying, which means that it is too hard, I get it. Okay, so instead of saying I understand how difficult it is, you can say I can only imagine how difficult it is for you. The next statement, I know it comes as a shock to you, please be strong. Okay, that is also a very common statement that we use, and if you guys have been following the role plays that we upload in our YouTube, this is a common statement that you can see in almost all the role plays that I do, because this is good all the time when we use in the role plays while we are talking to the patient, while we are telling the patient an upsetting news. You can associate this statement with it. When you said an upsetting news, this is what it is, and then you can say, I know it comes as a shock to you, but please be strong. Okay, so that is a beautiful assurance that you can give for your patient. I know it is really bad. I know this was not what you were expecting. Okay, so I know that. Please be strong about it. Okay, so that's a really beautiful statement that you can use in the grief scenarios. The next one is, I understand this is not what you were expecting. So we always know, even when we go to a hospital, what we are expecting is to hear a good news or a very hopeful news that everything is going to be fine, right? So the patient will be also having the same expectation. So when we are giving out an upsetting news, this is a beautiful statement that you can use. I understand this is not what you were expecting. I'm sorry to say that. Okay, which means that we understand that the patient was expecting something else, and I'm sorry that this is the opposite thing that happened. So that is a beautiful statement that you can use there. You can simply explain that to the patient. The next one, there is so much going on, how can I help you? So I would say these three, you can use it for the grief. Okay, I'm not saying that you cannot use these part, but these three will be more appropriate for the grief part, and this one would be more appropriate for the end stage. Okay, so there is so much going on, how can I help you, which means when you deal with an end stage patient, the patient is going through a lot of problems, a lot of fights. Okay, so you can say there are so much going on, how can I help you? Okay, you can use that. Can you please tell me what is the hardest part for you? Again, end stage patient, what difficulty they're facing, or whether the patient is having any sort of discomforts or any emotional problem the patient is facing. So you can check with the patient what is the hardest part for you. Okay, then you can assure the patient, I'll be here with you all shift. That means I'll take care of you. Okay, I'm really impressed how well you are handling everything. Okay, you can use that with an end stage patient, saying that you have come so far. Okay, amongst all these problems you are fighting so hard, so I'm really impressed how well you are handling everything. You're encouraging the patient there. Okay, so these are really beautiful statements that you can use when it comes to grief or end stage patients. Really emotional statements, as well as it relates you to the patient, as in it connects you to the patient. The relationship between the nurse and the patient will be a little more boosted when you use such statements there. Okay, so try to do that. So that is grief or end stage. Moving on to the next one, the last one, not the last one, so the second last one, I guess. Yeah, the concerned bystander. Okay, so I told you this is a very common topic that you always come across. So let's look into it one by one. The first statement. I totally understand you're worried about your child. Please don't be. We are taking proper care of your child. Okay. So it's a common statement. Okay. I'm just brushing up your knowledge. Okay. You already know it. I'm just brushing it up. Okay. These statements are not new to you guys. These are the common statements that you have been using, but I'm just framing it here so that it can be a reference for you guys. Okay. So by concerned bystander, this is a very good statement that you can use. I totally understand you're worried about your child. Please don't be. We are taking proper care of your child. Okay. Another thing, as a concerned parent, I understand how overwhelming it is for you. A common statement that we all use, right? Next one, your father is doing well, Mr. Alex. His recent reports are showing an impressive improvement. Okay, this is something that you can try to use. We don't use it very commonly. So his recent reports are showing an impressive improvement, which means that yes, he is responding well, he is doing good right now, he is stable. So we are actually showing a positive impact there. So this is a beautiful statement that you can use, showing an impressive improvement. Next one, your daughter is in safe hands. The medical team of your daughter is well trained and equipped, so please be relaxed. So we have normally seen that explanation, we have a well experienced and equipped medical staff who are trained to handle any sort of untoward situations. So this is a common statement that we use. So if you look here, that particular statement has been rearranged according to the context that you're dealing. Okay, so here we are dealing with the daughter's condition. So we change that entire, we have a good staff, your stuff into this. You said your daughter is in safe hands. The medical team of your daughter is well trained and equipped. So please be relaxed. See, that is how you can change it. Okay, when you learn a statement, try to change it according to the context or according to your flexibility, and try to create a new explanation so that you're more comfortable with it. Okay, I understand it's not very easy to learn a lot of information someone else is giving you, but it will be more easy for you to use that as a reference and then create your own explanations. That is going to be a little more easier for you guys. Okay, so try to do that. So these are the common statements that you can use to simplify the conversation between you as a nurse and the bystander. That means a concerned bystander. Okay, so I hope that is clear for you guys. Yes, so let's move on to the next one. Reluctant. Yes, I will actually come up with a separate session to deal with the reluctant, because I feel like it is a vast topic and there are a lot of areas that we can cover it. Okay, so soon I will be coming with a live related to reluctant cases, and we will use cue cards as references and then how to handle different situations. So I'm planning on that and I'm working on that. I will definitely come with a case note and different case notes and the topic reluctant, how to deal with it. Okay, so we will learn it together. So today I'm just going to take you through a couple of statements, okay, like the other parts that we have seen. So in this we are going to see certain statements and we are going to see how we can use it in the role plays too. Okay, so when you're dealing with reluctant case notes, the first thing is keep in mind, do not change your tone. Okay, try not to fluctuate your voice modulation. Don't get nervous. I know it is not very easy to talk to a person who is really angry or trying to be angry with you. I know it's difficult, but you have to understand, okay, this is just a part of the dialogues or the part of the tasks that you're doing. So based on that, try to improvise it. Okay, so first tell yourself, okay, this is just an act. Okay, don't take it personally there, and then be prepared with certain statements as a fight back. Okay, have some certain strong explanations or certain strong points from your end so that you can expect, okay, the patient is going to say like this, so at that time I'm going to explain like this. So if you are well prepared and if you have a strong explanatory point which is prepared with you, it is going to be a little more easier for you to handle with the reluctant cases. Okay, so let's look into 3 statements which we can use here. The first one is my personal favorite, and you guys might be already knowing it if you have been following my videos. Okay, I understand your reluctance, but I assure you that I have your best interest at heart. We're telling the patient, yes, I get that you're reluctant, but I have your best interest at heart means I wish or I mean your well-being. Okay, I want everything good for you. That is reason why I'm telling you this. Okay, it's a beautiful statement, and try to learn it. Whenever you understand, okay, my type of cue card is a reluctant one, then strike it. Okay, now I'll use this one. Okay, so that you will get an idea. Okay, reluctant cases, this is my statement. So you're good to go. You have a strong explanation there. Second one, I assure you that my main concern is your well-being. This statement, I assure you that I have your best interest at heart. This is a replacement for that. I assure you that my main concern is your well-being. I just rearranged it. Okay, certain statements were changed and I took the meaning. I took the meaning into another statement. That is what has been done here. Okay, I assure you that my main concern is your well-being. Okay, that is the reason why I'm telling you this. You can explain like that. The next one, I can see that you're really upset. I'm here to help you and hear you out. Okay, there is one too here. It's missed out. I'm here to help you and hear you out. Okay, please tell me what is bothering you. Okay, there is a typing mistake here. So it is I'm here to help you and hear you out. Please tell me what is bothering you. Okay, so that is also a very beautiful statement that you can use when the patient is really angry. You can tell the patient, I know you're upset, I get it, but I'm here to help you and hear you out. Okay, I'm not just here to help you, but also to listen to what is your problem. So could you please tell me what is bothering you? So that is also another statement. So this statement can be used in scenarios where the patient is unwilling to give out information. So you have seen that such cue cards, right, where we are asking the patient, could you tell me what is worrying you? So the patient, I don't want to talk to you. Okay, I'm not happy with your service. I want to talk to someone else. I'm not giving out any information. So you can use this statement to such patients. I can see that you're upset. Okay, but I'm here to help you and to hear you out. So could you please tell me what is bothering you? Okay, so that these are certain beautiful statements that you can use. All right. So that being said, that is the end of the type of cue cards that we are going to discuss today. So as a recap, we have seen the different types of cue cards. That means we have actually picked the common 6 cue cards. The first cue card was informative type of cue cards. Then we have the emergency cue cards. Then we have mental health cue cards. We have grief end stage, concerned bystander, reluctant. Okay, so if you'll be asking me, there are different types of cue cards like community health center, school health nurse and everything, right? So such things will come here. Informative, all type of cue cards where you are giving information will be categorized here, and all types of cue cards where the patient is in a really difficult situation like an emergency situation and the patient requires immediate care or something like that, it comes under here. And all type of mental health here, and all type of sorrowful cue cards where the patient is really melancholy or the patient is in a very sorrowful situation, it comes here. And wherever you're having a worrying or a concerned bystander or a patient kind of a cue card, it falls here. And when you're dealing with agitated, frustrated, furious, not cooperative patients, it comes here. So these are the common 6 categories that we can have. Okay, and I have explained what are the things that you need to understand in these particular cue cards too, and certain statements that you can use to simplify it as well. Okay, so I hope it is clear for you guys, and if you guys find it really helpful, make sure that you comment it down, and we will definitely go through it. And as well as if you find it really helpful, share it with your friends who are also preparing for OET. So let it be very helpful for them as well. Okay, so as I said, I'll be soon coming with a live session where we are going to look into the reluctant cases in depth. Okay, so I'll see you guys next time. Until then, you take care, and as I said, if you have any questions or concerns about any topics or anything, feel free to comment down and we will definitely get back to you. Okay, so thank you so much for your time. Take care. Bye bye.
IILT, it's my cup of tea.